Okay, so we'll just give it a moment for participants to roll in here. We'll give it about a minute or two for people to start signing in, and then we can go ahead and get started. Okay, I can see some attendees now, or one attendee. Perfect. Morning, everyone. For those who are here right now, if you could just type something in the chat and let me know that you can hear us okay, that would be great. Oh, perfect. We've got some hand raises. Awesome. Thank you very much. So we'll just give it a minute or two for people to log on, and then we'll get started with the webinar shortly here. Did you want to get your screen share set up right now, Catherine, or just do that after?
Yeah, we can do it right now. That's completely fine.
Sure.
Am I a co-host? Am I allowed to share?
Should be able to. Let me. I will make you the co-host here.
Perfect.
Awesome. Okay, we have quite a few more people rolled in. Good morning, everyone. Perfect. Okay, so I'll start with a brief introduction, and then I will let Karin and Catherine take over. So hi, everyone. Welcome to the How Can Occupational Therapy Help with Parkinson's webinar with Karin Werther and Karin Lambert. My name is Declan Beto. I work in client services with the Parkinson Association of Alberta, and I'll be the moderator for this webinar. If you have any questions right now or during the webinar, please submit them in the chat box below. So there should be a chat box somewhere on that bottom bar of your screen, or I've been told sometimes on iPads it's at the top or to the side. So look along the borders of your screen and find that chat box if you have any questions. Click it and the chat will appear on the right-hand side. You can send your questions out to the whole group or just to panelists with the little drop-down arrow. Brief disclaimer here, all information provided in videos by Parkinson Association and the featured speaker is furnished strictly for educational and entertainment purposes only. This service is not intended to be diagnostic, prescriptive, or replace the relationship, advice, and/or care of your physician. General questions about symptoms, treatments, available medications, complementary alternatives, and alternative healthcare therapies and current research will be fielded. So now allow me to introduce Karin Werther. Karin is a clinical instructor in the Faculty of Rehabilitation and Occupational Therapy at the University of Alberta with a Bachelor's of Occupational Therapy and a Master's in Rehabilitation Science. Karin has 17 years of frontline clinical neuroscience experience in acute care and rehabilitation services. And Karin Lambert is an occupational therapy PhD student. So welcome, both of you. Thanks so much for being here today.
You're so welcome. Thank you so much. It's a pleasure.
Yeah, thank you so much for having us. So I can get started. So of course, we're here to talk a little bit about occupational therapy and its role in Parkinson's disease. And so, of course, just like Declan said, if you have any questions, really feel free to put them in the chat box throughout the presentation. We really want this to be informal and casual and you to feel comfortable to ask us questions whenever. So really feel free to do that. Our main sort of purpose for this presentation is that when you leave this presentation, you'll have an idea of how an occupational therapist can work with you or your loved one to help manage Parkinson's disease and kind of just understand a little bit about what our role is in the rehabilitation process. So just for a brief introduction, a lot of the time when we think about Parkinson's disease, we think about the motor symptoms. So for example, the tremor, the stiffness, the slowing down of movement, the poor balance. And of course, there are many other symptoms as well, besides just those motor symptoms. So sometimes people find their attention and memory can be a bit affected. They have digestion problems. They can experience fatigue. And what all of these symptoms do is that they can have a really negative impact on your ability to perform your daily activities. And when we're talking about daily activities, what we mean are both the activities you need to do. So things like getting out of bed, showering, dressing, making a meal, and then also the things you want to do. So this could be your hobbies, whether that's something like reading or playing golf or watching hockey, visiting with friends and family, when we could do that in person, although of course it looks a little different now for us. A lot of the times it's a bit more over Zoom at the moment. And then accessing the community. So whether that's being able to go to the Parkinson Association of Alberta and engage in the programs, being able to go to community events, concerts, those sorts of things. So because of the symptoms of Parkinson's, they can have a significant effect on this. For example, a tremor can make it much more difficult to get dressed. Fatigue can make it much more difficult to go on a walk outside or to visit with friends. And this can have a significant impact on our sense of self and our well-being. So how we think of it in occupational therapy is a lot of the times the activities that we do, they're a way of expressing ourselves. They're a way of living what is important to us and what interests us. And so when we can't do those activities, it has a significant impact. A lot of the times how I think of it is we don't think about how important showering is to us. We want to be clean, we want to look nice, we want to be hygienic, but we don't think about how meaningful it is to us until we can't do it independently, or until we're nervous to get into the shower because we're scared that we'll fall. And being able to do that independently, or as independently as possible, then becomes very important to us because we want to be independent, or we want to do as much as we can. And that's the same with things like participating in hobbies that you love. Once you're no longer able to do those, or you're struggling to do those are your interests and your passions. And so if you're restricted in your ability to do them, it can really impact your well-being. And so this is where really occupational therapy comes in. So these are some unflattering photos, but in occupational therapy, what we are is we're a rehabilitation profession that works with both physiotherapy and speech therapy a lot of the time. And we focus on helping individuals to maintain function in their daily lives and their daily activities. And so we usually group activities into 3 different areas. That's why there's 3 pictures of me. The first is me at school. And so one of the areas that we talk about is productivity. So that's things like volunteering in your community, going to work, going to school. The middle is me attempting to hike. So that's supposed to be hobbies. Again, things like reading, watching hockey, visiting with friends. And then the last, the most flattering of the photos, is more personal care. So eating, because I love ribs. That's the best photo I could find of personal care. Those more basic things like eating, getting out of bed, showering. Daily activities, they usually fall into one of these 3 categories, and we consider all of them. So we work with people living with Parkinson's disease and Parkinsonism in a range of settings. So both Karin and I have worked with individuals with Parkinson's disease. I'm a PhD student right now, but I did work and continue to work on a casual basis at an acute care hospital in Edmonton. And I have worked with many individuals with Parkinson's disease in that setting. So we work in hospitals, often with physical therapists. But then we're also really involved in the community. So for example, you will often find occupational therapists in outpatient rehabilitation. Now, generally outpatient rehabilitation, when we talk about that, it's through a hospital or a health center, depending on what city you're in or what town. And you usually come in a couple of times a week and you set goals with a therapist and you get some more intensive rehab one-to-one. We're also very involved in home care. So us coming into your home and working with you. Exercise and wellness programs throughout the province, and occupational therapists may be involved in those in more of that group setting. And then lastly, community day programs. So sometimes individuals, it may be the later stages of Parkinson's disease or the earlier stages, depending on how they're feeling or how their caregiver is doing. They may attend community day programs where they go for the day for about 8 hours. And there's often an occupational therapist there as well. So in terms of what we actually do, occupational therapists, we are activity experts. We are trained in analyzing activity. So we look at how you perform an activity and we break it down into its component parts. So getting dressed, you may think of getting dressed as just getting dressed. You're putting on your shirt, you're doing up the buttons. But as occupational therapists, we're going to look at much more than that. We're going to look at, okay, what room are you doing, getting dressed in? Are you having any help? What is the lighting like? What is your range of motion like in your arms? What are your fine motor skills? Are you having difficulty paying attention? These sorts of things. We really break it down into these minuscule parts and look at how everything interacts together. And then what we do is we come up with different strategies to address these different parts to find how to make the activity safer for you and easier for you to perform. And the nice thing about this is because we're looking at all of these different factors, if one strategy doesn't work, that's okay. We always have a dozen more. If we're looking at all of these different things, sometimes what works for one, a lot of the time actually, what works for one person doesn't work for another. And so that's really what we're looking at is we come up with all these different ideas and then we trial them. And if they don't work, we go back to the drawing board and come up with more ideas. In general, our strategies, they do fall into sort of one of three areas and they do overlap quite a bit. So the rest of the presentation, we're going to kind of break down each of these areas and talk about some of the strategies we usually focus on, but you'll see that there's a lot of overlap. There's a lot of gray area, but generally it's these three areas. The first is the person, so who is doing the activity. Now, there are common symptoms in Parkinson's disease, but everyone has their own unique experience with the disease. They have their unique situation, they have their own passions and interests and values. And so when we're looking at working with an individual, we really need to consider what's unique about that person. What I recommend for an individual who is particularly has difficulty with tremor and lives alone is going to be different for another individual who lives with their family and has more difficulty with balance, right? We're really going to try and tailor it to the person who's doing the activity. The next thing we look at is the occupation. Now, occupation, which is in our name, for this presentation, what I would say to think of it as is meaningful activity. So something that occupies your time that is meaningful and important to you. So those daily activities I was talking about, your hobbies, volunteering, your personal care, those are occupations. And so what we look at is what is the activity that you're doing and why are you doing it? And then also what's your method of doing it? How are you going about performing this activity? And then the last thing we look at is the environment. So this is the setting where the activity takes place. And we don't just mean the physical environment like your home, although of course that is a component, but we also are thinking about what community do you live in? What sort of social supports do you have? So they're quite broad areas that we're looking at. And then, of course, just as Declan said, we are going to provide some basic strategies, but all of these are very personalized to your unique situation. And so it's all about how these things interact. So we're going to always look at these three things with a client. And so it's always very unique to the person we're working with. So we can give general strategies, but we don't actually know what works for you necessarily because, of course, we haven't worked with you. So just that disclaimer as well. And I will now pass it off to Karin.
Thank you, Catherine. Really good start there. So one of the first things we do as occupational therapists is to kind of get to know you a little bit. So what is important to you? What are some of the activities that you like to do? But also, how are the symptoms impacting your ability to perform the activities that you want to do, need to do, or hope to do in your day? So what is meaningful to you? What brings you joy? And how is that impacted by your disease, your illness, your symptoms? So the examples we're going to give here are some of the areas that we commonly see that may impact you as an individual because of your illness, but maybe because of other areas as well. And as OTs, we're hoping to get that whole perspective of that. So one of the things that we notice in a lot of our clients is that staying active is important and essential and can often be impacted by a disease or an illness. And often people think of staying active as being within the scope of physical therapy, which of course it is, and we work closely together. But it's also essential in preventative care, in ensuring a sense of well-being. The endorphins in your body can really give you that positive sense and positive feeling. It's important in being able to maintain the physical activities you need to do in a day, but also how it impacts your daily activities. So having good range of motion in your shoulders is not only helpful when you do your yoga or your Tai Chi, but it also can impact putting your laundry away or putting your coat on, and you need functional mobility in your shoulders for that. So it's an area that we collaborate often with PT about, but also an area that as OTs we would hopefully be able to assist you with. So another area that we'll often see in Parkinson's clients is posture. And we'll often notice that slouched posture with potentially can impact your balance, your lung capacity, your functional mobility. So maintaining good posture, exercising in that area, but also looking at how is it impacting your daily activities? How are you sitting? How is your chair either helping your posture or maybe negatively impacting your posture? How is it potentially impacting your ability to have an effective swallow? Balance and falls prevention is another area that's connected to posture and functional mobility as well. So it's again an area that other professionals might be involved in as well. But as OTs, we would definitely be able to further assess and work with you together to see how we can help you in that. Also looking at the person is your upper extremity mobility and movements. When we engage in our environments, we often use our arms and hands to reach for objects, get dressed, play a game. So all the things you need to do often involve upper extremity mobility. So maintaining good function in your arms and in your hands, and then really focusing on the individual, as Catherine said as well. So we're trying not to give you an exercise program that's a lot of people use, but really tailoring it to your needs and what you want to do. Not everybody enjoys going to the gym or doing repetitious exercise programs. So is there potentially a different way of maintaining functional mobility as well? Okay, so movement strategies. In Parkinson's disease, we often see the stop and go problems that people might have. So are there some strategies that you can use or that your caregivers can use that potentially can help you stay active and maintain functional movement? So for some people, that could be visualization of activities. So really, you see that often in sport exercise as well, where people think about the activity they want to do or need to do. They get their brain set up and visualize how it might look for them, and then they perform the action. Another one is self-talk, and you probably heard of those before. So self-cueing could be as easy as counting 1, 2, 3, go. Or mental rehearsal is another strategy that is often used in Parkinson's, but also in sports medicine, in stroke clients as well. And again, connected to that visualization of your goal as well, where you maybe practice the activity in your head first before you actually practice the activity in your daily activities. Fatigue is a common factor, and which the medication as well. You might have times in your day where you have more energy, you feel more active, you have the ability to do some activities, whereas other times in the day, your fatigue levels might really impact your ability to perform activities. So really looking with a person at what are the activities you need to do in a day and you want to do in a day, and how can we be planful about that and organize your day so that you are able to perform the activities that you need to do, but also building in resting moments, or looking at, rather than vacuuming your whole house all in one day, maybe spreading vacuum cleaning out over a couple of days. So it's not taking all the energy that you have in a day to perform that activity. Okay, and with fatigue, of course, we think of sleep, and sleep can be really restorative. It's an ability for us to heal our brain, but we also need it to restore and build energy for our next day. And having bad sleeps can really impact not only your physical abilities, but also your mental and cognitive abilities. So having a good night's rest is really essential for all of us. And as OTs, there are some sleep hygiene principles that we can look at. And, some of them are really common. Not watching TV or gaming in the half hour before you go to bed. Keeping your bedroom to sleeping only and not performing other activities in the bedroom. Those are some really easy, helpful tips that might help you in improving your sleep quality. As I mentioned, not having enough sleep can impact your cognition, but so can Parkinson's disease. So can your emotional status and how you feel. So a lot of things that can impact cognition. And as OTs, it is part of our scope of practice as well to work with you and look at what are some of the things that potentially can impact your thinking. How is it impacting you in your day-to-day activities, and what can we do about it? Is there a potential for some exercises in cognitive rehabilitation, or is there opportunities to maybe use some assistive technology to make it a lot easier? So the phone is a really helpful tool in helping us to plan our days, memorize what we need to do. Medication management and having an alarm system on our phone can be helpful in that. Well-being, essential, right? We need to look after ourselves, and COVID has taught us a lot about that for most of us in the recent months. But keeping emotionally and mental well is essential, and that can look really different for all of us. And different things, different meaningful activities can assist us in maintaining our mental well-being. And again, it's a domain that as OTs, we can help you assess what it is looking like for you currently. What are some activities that really give you satisfaction and meaning in your life? And how can we assist you maintain those activities, or maybe develop new activities that are meaningful for you?
Okay, and so those are some examples of what the things that we're looking at that are really sort of focused on the person and your unique sort of symptoms and experiences with Parkinson's disease. The next thing we look at is the occupation. And so, as I said earlier, when we refer to occupation, we're really talking about that meaningful activity. And so it's all the things you want to do, you need to do, or you enjoy doing. And so as occupational therapists, we can look at a variety of things. One thing we really focus on is making activities easier and safer for you to perform. We also consider about regaining activities. So a lot of the times in Parkinson's disease, particularly as the disease progresses, we may lose some of those activities we used to love doing. And so we may explore ways to make modifications or adaptations that you can return to those activities. They may look a little different, but the idea is to really keep that same meaning of the activity there. And then the other thing we look at is exploring new activities. So looking at different sort of hobbies or therapeutic activities that you can engage in that are meaningful to you and interesting and new. So one of the first things when we're looking at activities is really sort of scheduling. So I know Karin already talked a little bit about looking at your day and pacing it and arranging activity so that it's not as fatiguing. This is also just really important in terms of making the activity easier for you to perform. So you will all know better than me that with Parkinson's disease, you have your on and off periods. And so one of the really common things that we would look at is recommending your more difficult activities that you plan them during your on medication periods, because then they're going to be easier for you to perform and less frustrating. Another thing that we often recommend in terms of Parkinson's disease is arranging things so that you're not performing difficult activities in a time constraint situation. So a lot of the times one of the examples that I can best think of is if you have a doctor's appointment and maybe you're in a bit of a rush, and then that's when you're going to be buttoning up your jacket or tying up your shoelaces. And maybe that's particularly difficult for you. And then you have this time constraint and you're rushing, and then it becomes more difficult, and then it becomes more frustrating, and everything adds onto one another. So something we really explore is, okay, how can we time these activities so that you have enough time to sort of use a strategy and to not get too stressed or too frustrated. One of the really big things we look at is proper body mechanics. This is something that I really look at, we really look at in acute care, but it's used throughout rehabilitation and outpatient rehabilitation, home care, exercise programs. When we talk about body mechanics and rehabilitation, what we refer to is the way you position your body during movements. And so the way you hold your body, the way you're moving your body, your center of gravity, how you're using it, these sorts of things. And so making a change in body mechanics can make difficult movements much easier to perform. And the classic example that I use for this in terms of Parkinson's is what we call sit to stands. So in Parkinson's disease, a lot of the times people will have difficulty standing up from a chair or standing up from a bed. And oftentimes what we find is people are thinking about standing up. And so, of course, I can't fully show you on Zoom, but they're just sort of focused on going upwards. And with a lot of individuals, of course, again, this isn't prescriptive, but what we always say is nose over toes. And so what you're actually wanting to do is lean forward a little bit until your nose is over your toes, and then you push up. And so that's sort of changing the force of the movement a little bit, using different muscles. And a lot of the times individuals then find it easier to stand up. So that's one of those examples there where you're just making a little bit of a change and it can make a huge difference. Another thing that we will often talk about is how we can adapt activities to make them a little bit simpler in terms of multitasking. So in Parkinson's disease, one of the big things is that you have to pay a lot more attention to your movements. You have to pay much more attention to your posture, to taking steps. And because of that, multitasking can really increase your risk of falls because you're not paying as much attention to your body. And of course, there are situations where you have to multitask. When you're walking, you have to multitask a little bit because you need to scan your environment to make sure you're not stepping on something. But you want to try and minimize additional distractions. And so one example that I can think of is in terms of chopping vegetables for dinner. So even for myself, I have to really pay a lot of attention. I've had some mishaps before with a knife cutting vegetables. And so with Parkinson's disease, if you were also standing at a counter and talking to a family member while you're chopping the vegetables, that could really have a detrimental effect on your balance or make it more difficult with the chopping because you're paying attention to all these different tasks at once. So we often recommend things like sitting down when you're chopping vegetables. Another big thing I've often recommended is if you're walking or you're standing up in your house and then you want to have a conversation or you want to stop and say something, I often recommend putting a hand on a counter or on a surface and stopping walking. And that's just because then you can pay much more full attention to your conversation without also having to worry about your balance. Something else we really want to consider is what I would call the why factor. And so this is analyzing why a certain activity is important to you. So as I said, sometimes in Parkinson's disease, we lose the activities that are important to us. We find that we're no longer able to engage in them. And this can be, a grieving process because these may be activities or hobbies that we love. And as occupational therapists, when we're looking at adaptations, we really want to understand why you love the activity so that we can make sure that we tailor our intervention to that. So a classic example or an example that I would think of is something like dancing. Say you took like a ballroom dancing class and you're no longer able to do that because of the symptoms of your disease. And so we would look at, okay, why do you like ballroom dancing? Do you like those classes because you love the music? Do you like it because there's that socialization piece? You really like your class and you like going and talking with individuals, dancing with another individual? Or do you like the physical activity component of it? Do you really enjoy the movement and you feel sort of more limber and stretched afterwards? Those are the sort of things we would want to look at, because then we could see, okay, how can we adapt something like ballroom dancing and explore an activity that is similar to that or has similar components that are meaningful to you. Activities are not set in stone. Activities are flexible. Like I said, it may not look exactly the way you did it before, but there's always lots of different ways that we can adjust them so that we can keep them meaningful to you. Other things that we really look at that occupational therapists are often considered sort of the experts in, this is one area that we know a lot about and get asked a lot about, is adaptive devices. So these come in small and big portions. So in some cases, in terms of smaller adaptive devices, there are just tools that make it easier to perform certain tasks. So I have a picture here of a button hook. Unfortunately, I don't have one here to show you, but if you're having difficulty fiddling with your buttons and putting them in, the button hook can help you sort of slide the button through the shirt so that you're not having to fiddle as much. Another common thing is a weighted pen to write, or utensils with built-up handles so you don't have to have as much grip strength. Now, I am sure, I have volunteered at Parkinson Association of Alberta before. I've worked with members of that community, and I remember some of the members would come in and they would always have these new devices or tools that they would have. So whether it be their pens or a certain mug that didn't spill if they were having a tremor, that sort of thing. So you probably know a lot about these as well. But there are tons of these sorts of things on the market, and an occupational therapist can really help determine what the best ones are for you, because they can be a little bit overwhelming, and also sometimes they can be a bit unclear of how to use properly. And so that's another thing that we can really help you with. These are just some examples of adaptive devices in terms of housework. So the first one there on the left is one that I could probably use myself. And so it's if you are having poor grip strength for opening a jar, instead you can use the weight of your palm, and that will help you to open up the jar lid. Another example is sort of a stand to help with a pot with something boiling in it or hot, to make sure if you're having a tremor that nothing spills. And then the last one, which is especially I find helpful in Parkinson's disease, is a cutting board, where what you do is you don't have to use both of your hands. You don't have to use a hand to sort of hold the vegetable or the fruit. Instead, you place the fruit or vegetable on those two prongs. And so then that holds it up, and then you can cut with the knife, so that then you're not having to worry about, say, if you have a slight tremor, trying to hold on to something and then using a big knife as well. It sort of helps you with that. And so these devices, what they're really for is they keep you, as we said, independent and safe as much as you can. The idea with occupational therapy is we really want you to try and stay engaged as much as you can. And these tasks, they make it just that little bit easier so that you can keep doing them on your own to the best of your ability. And then in terms of adaptive devices, you can also go bigger. And a lot of the times we also talk about equipment for the home. So changing how you do an activity in terms of maybe you need a little bit more help in terms of equipment. And so this is where occupational therapists in home care can be very involved. And so they will often come and do an assessment of your home and determine what equipment is best for you. So I have a couple of pictures here, but in terms of a lot of the times we talk about railings for the stairs. And a lot of the times it's not just a railing for the stairs. You might think, oh, I can just install a railing, but an occupational therapist will go, okay, but which side? Do you need them on both sides? Do you just need it on one side? What side of your body is more affected by the disease? Do you need a railing as well at the bottom of the stairs and upstairs at the sort of wall across from the staircase, that you have something to hold on to when you get to the top? These are those sorts of things where we really look at the full environment where you're performing, and we can sort of make those more clinical decisions. Another really common thing we look at is the bathtub. So I have a lot of patients who have walk-in showers, and they can find those really beneficial, but sometimes it's actually easier to shower in the tub if you adapt it properly. So it just depends. Sometimes if I think of the little tiny corner shower in my house, if I have a really tall gentleman and I try and fit a seat in there for him and he tries to sit down, his knees are just going to be up against the wall and it's not as comfortable. So we might look at the tub. We can also look at adaptations for the shower. It just depends a little bit on what your house looks like. And then a couple of other sort of larger equipment. One thing that is particularly we have found beneficial in Parkinson's disease is what we call sit-to-stand chairs. So these chairs, they don't just catapult you up, they slowly sort of rise up and bring you into sort of more of a standing position from when you're sitting in them. And so it just saves you that little bit of energy. As I said, lots of times going from sitting to standing can be very difficult in Parkinson's disease. And so this chair does a little bit of that work for you, and they can be really helpful. And then another thing is a bed rail. So for getting out of bed, in terms of going back to sort of that body mechanics piece, sometimes what we look at is in what we call something called log rolling. And so that's really, if you're lying in bed, you're reaching across with your arm and you're bending up your knees, and you're really using that weight of your arm, that force of your arm, to kind of roll yourself to the side. And then you get out of bed from there. And so a bed rail can be very helpful, because if you're reaching over, you can grab onto that bed rail to help pull yourself up. So these are some of the things that particularly an occupational therapist in home care would really be able to talk to you about and help set up for you.
Okay, and then our third component that we look at as OTs is the environment. So we look at the person, how they perform activities, what activities they would like to perform within the context of the environment. So not only your physical environment, what is your home looking like, what adaptive equipment do you have at home, how do you move within your home environment, but also looking at the bigger picture there as well. Community access, and how do you travel to and from your children, your friends, your family members? How do you access your community in going to the grocery store, or going to church, or your recreational center? Do you use your own transportation? Are you having to rely on other people's transportation? And what might that be looking at? But also looking at resources and what is available for you in the community. How do you maybe get some of the assistive technology that's out there, or home adaptations? What research opportunities might there be available for you to participate in? What other organizations might assist you and benefit you in your disease management? Oh, so one of the most important things, I think, when we think of environment is our connection with other people. We are social beings. We need other people to feel well and to, and I'm sorry, that's my demented cat meowing away. Sorry about that. So staying connected with your loved ones, with other people in your communities, and having the ability to do so. Currently, most of us are working online. So is there a way for you to adapt your computer that it's easier for you to access your computer without the tremor interfering with your mouse? So there are special mouses available within the common domain that you can purchase. Keyboards that are less sensitive, so that when you do have a tremor, that they're not the keyboard that is not going to respond as quickly. And those are general settings within the computer that you can adapt. Looking at services available in your community, from recreational activities to educational opportunities to being connected to Parkinson's associations. So the one in Alberta is one of them, but there's also other opportunities within maybe the National Parkinson Association or the American one. And Peter, I'm going to talk a bit about that in one of the slides as well that's coming up, on how to access OT as well as some of the other services. Okay, and looking at our environment and how we access our environment. So what is helpful for you in cueing maybe yourself, or having somebody else cue you? So it could be an auditory cue. So somebody counting 1, 2, 3, go is one. Another one is music, and sometimes music can make it a lot easier for us to be able to initiate movement and activation. metronomes, so as simple as one that you use maybe for the piano, or there are apps available as well on a phone that you can use. And sometimes that rhythmic auditory cue can be enough to help somebody initiate movement and get going. Okay. The other cues, so we can have auditory cues, but we can also have visual cues. And visual cues could be helpful, but can also limit a Parkinson's client. So sometimes having a goal, an aim, so here you are aiming to step onto the tape, can be really a cue that somebody can use in order, again, to stop that freezing moment and keep going in a movement. But sometimes what we'll see as well, that changes within the environment. So if there is a change in the floor, maybe from carpet to linoleum, is that can actually stop a client from moving and cause a freeze to happen. So looking at some of those environmental assessments and seeing if we can use some visual auditory cues in order to assist the client in their stop and go movements. Okay, organization of your environment. And I think this might be Catherine, her desk as a PhD student, she's keeping busy. But decluttering can help, and not just decluttering your physical environment, but also decluttering your life and your brain, and helping yourself stay focused on the goals that you want to accomplish in a day. Decluttering your environment, mostly looking at, again, falls and falls prevention, making sure you don't have any cords or carpets lying on the floor that are potentially a tripping hazard, something that can distract you. And as I mentioned before, the different flooring can really make somebody freeze as well in their movement. So sometimes just removing a carpet can ensure that somebody's able to keep going in their movements. Okay, then another area that we look at as OTs is your support system. So who is there to help you, and how can we help your environment as well? Because Parkinson's disease can have its toll on the client, but it can also really impact your loved ones and their well-being. So are there ways we can make life easier for both of you? Is there an opportunity for us to teach your caregivers on how to make transfers easier, how to best help you, what cues they might use, but also looking at supports in their mental well-being? There are lots of caregiver supports groups, and is that something that they might benefit from? Are there maybe some mindfulness or some meditation aspects that could help them in just relaxing their brain and their mental health? So really, and again, it's really individual based on what works best for you, your family members, your support system within the context of your environment. Okay, transfer training. So transfers, as Kathy mentioned, are one of the areas that we'll often see problems in. And again, looking at, is there a potential for aid? Are some of the cues helpful for you? Can you use your cues yourself, or is there a way we can educate your support system in how to best help you? But also, how can we ensure that the way you are functioning within your environments is safe, and we really limit the potential for falls? So education is really essential, and not just education in transfers, but education in general. How can you as a client educate others about the care needs that you need? How can we educate your family and your support system in how to best assist you? But also, how can we assist your environment in ensuring you get the needs that met that you have? Okay, the other thing that we look at is therapeutic activities. And those are activities that are not only meaningful and helpful to you, but also have that underlying therapeutic goal that we need. So sometimes dancing can be a lot of fun, but it also has a therapeutic meaning in that it really assists in your balance and maintaining balance and maybe improving your balance. Playing cards comes up in a slide here. Again, can be a fun, meaningful activity and is something you can play with your loved ones, with your grandchildren. But it also is therapeutic in that it activates your cognition. It relies on some of your memory and your attention, and again, assisting in prevention of decline, but also maybe improving some of those cognitive functions that you might have. So therapeutic can mean different things for a lot of different people. Our SOTs, our main focus is that it is meaningful to you. So have you always loved gardening and you want to continue on gardening, but you're having a hard time going down onto your knees? So is there maybe a way to perform the activities, so still garden, but maybe in a standing format? And how can we then maybe adapt your environment? Hobbies and activities that have given you joy and fulfillment and connection with others is essential in that as well. So I talked a little bit about the cards already, but playing games, staying active, learning new activities, picking up old hobbies that you had before and maybe you've not done in a while, or learning new activities can again really be helpful in learning, maintaining, and really building on some of your cognitive components. And then if you're anything like me, focus on your patience as well. Okay, the other thing that we just quickly wanted to highlight with you is that learning new strategies, learning new activities, learning how to do things in a different manner, it takes a little bit of time as well. And the earlier sometimes we can be there and assist you and talk about new ways, different ways, the easier sometimes it is to implement it and sustain over time. Sometimes I think as OTs, we feel that maybe we are not involved early enough. And had we been involved earlier, then maybe we could have helped you earlier in establishing some of your new routines, your new ways of being. So please do consider connecting with us early on if you can. So just in conclusion, as OTs, we can look at helping the person within their environment, doing the activities that they need to do, want to do, are meaningful for them to do. And hopefully when we look at all of these three components together, we can really optimize your ability to do and perform the activities that, that you're hoping to do. So Peter, hopefully this will answer your question. I saw it in the chat box. So how do you access an OT? We are not that well known as a profession by the general public, but most healthcare professionals will know about us. So when in doubt, ask somebody. But OTs should be available for every single person living in Alberta through home care. So every home care area will have an occupational therapist that you can access. If you are in a rural community, maybe the OT is only available 1 or 2 days a week. In more of the urban settings, there are more opportunities usually. So you can access not only through home care, but in bigger communities, outpatient programs will often have rehabilitation services available for you. So not only occupational therapy, but also speech therapy, physical therapy are often connected to some of the outpatient programs. Exercise programs will look a little bit different within different communities as well. Sometimes certain exercise programs like the YMCA may have somebody available to you who is specialized in looking at what it might exercise look like for somebody with a different diagnosis or underlying health condition. And they might be special in adapting exercise programs for people with Parkinson's disease, but also people with maybe other underlying conditions. Okay, and of course, the Parkinson's Association of Alberta is a really good resource to kind of ensure that your needs are met. So do ask. If you're not sure, ask other people and see if they can help you find an answer. And then Catherine added a link there as well for a Parkinson organization as well. So if you are looking at educational resources, or you are looking at maybe being involved in research, there are options out there. And sometimes it does take some time to find them. And again, ask for help when in doubt. So Peter, I hope that answered your question on how to access occupational therapy. So the easiest would be through home care. As any person within Alberta can submit a self-referral to home care by phoning into the phone number. You will get a person who is your case manager, and you can ask them for resources and indicate to them that you think you might have a question for the occupational therapist.
And I would say definitely, just to add to that, from my experiences with home care and the individuals I know who work there, home care will have a really good idea about the outpatient programs specific to your region. So I personally am much more familiar with the programs in Edmonton, but oftentimes home care can initiate those referrals to you or referrals for you, or sometimes it's through your physician, but home care will have a really good idea of, they may come in, an occupational therapist may come in and take a look at your home, but if they think, you might benefit from a bit more of something intensive, they may be able to make that referral to that outpatient programs. But they're going to have that really, the home care individuals really, especially the case managers, are the ones that have a really good idea of what resources are specifically available in your region.
So that takes us to the end of our presentation, and I checked the chat box. There are no other questions in there right now, but does anybody have any questions for us?
Yeah, thank you so much. And maybe I'll ask one in the meantime and give people some time to type out their questions if they've got something. For some of those adaptive tools that you talked about earlier, or even like the lift chair, how does someone go about paying for that? And is there payment supports for those sorts of things, or is it the responsibility of the individual?
So Karin may know this better than me. From my experience, from my knowledge, through Alberta, there's Alberta Aids to Daily Living. And so they will support purchase of equipment, especially if it is through a referral. It has to be through a referral of a healthcare practitioner. So like an occupational therapist. And that's actually where it's really beneficial to work with us, is because we can help initiate that process instead of you going out and buying some of these things. So with Alberta Aids to Daily Living, if I'm correct, they usually cover 75% or up to maybe $250, $500. I'm trying to remember.
$500, yeah.
Either up to $500 or 75% of the device or equipment. So that's something where we are very familiar with Alberta Aids to Daily Living. And so we can sort of really facilitate making sure that it's covered for you.
Yeah. So unfortunately, Aids to Daily Living only assists people in the larger equipment needs, so your home adaptation. So if you need a shower chair or a wheelchair, a walker, maybe a lift, so they can assist you in some of those areas. However, if you're looking at devices that assist you in some of your daily activities, such as the button hook, the cutting board, those unfortunately are not funded, and you would have to purchase. And again, OTs can help you with that as well, and find you how to purchase it.
Great, thank you for that very in-depth answer. My second question is also just a reminder to people, if you'd like to ask a question, you can post it in the chat box on either the bottom or the top of your screen, depending on what device you're on. The second one that I had as well is that, at what point in someone's Parkinson's journey should they look at contacting an OT, say from like being just diagnosed, or or a few years in, or when should people start to look at accessing an OT?
I think it could really be at any stage. As soon as you find that you are having maybe a harder time doing the things that you want to do, need to do, or would like to do in your day, absolutely connect with us, and we would be able to assist. And that could be, you know, as early as your diagnosis, or your tremor is impacting your ability to eat, or you're finding that stop and go is becoming a problem in accessing the community. It's more difficult for you to get out of a chair. So at any point in your day-to-day activities where you find this is becoming harder for me to do, then that might be a good time to connect with occupational therapy. And as OTs, we will explore all the different domains as well. And hopefully, as we get to know you, have a better understanding of some of the other areas where we might be able to assist as well.
Great, thank you. We did have one question come in regarding the aids that we talked about previously there. Where are these helpful aids available? What sort of retailers do you recommend?
So Pearsons Canada is I think they had a name change. So I'm just gonna look and see if I can find the link, and then I'll post a link in the chat box.
Yeah, there's lots of different vendors available. And of course, I can't explicitly recommend certain ones because they're all sort of different. Definitely Pearsons. I know there's any sort of health equipment store. So like Healthcare Solutions, I believe, should be able to carry them. Pearsons is the main one that I can think of, but it has had a name change. So
yeah, do you know what the name change is? I'm just looking at it.
I'm trying to think. Healthcare Solutions, there's Eco Medical is another big one. If you look up any sort of health equipment store, they'll have them.
Great, thank you. I suppose we'll just wait a moment and see if we can find that name change. But yeah, if not, like Catherine said, any sort of home healthcare device store.
I'll just stop and.
Great. Well, maybe I'll read out my my brief outro here, and we'll see if we can find that name at the end of it. But I just want to thank both of you for coming in today and performing such a thorough presentation on occupational therapy. So thank you very much, Karin and Catherine, for being able to join us for this webinar on occupational therapy and Parkinson's and sharing your knowledge with us. We really appreciate it. Thank you to everyone who joined us today, and our next webinar date is going to be January 20th. Our next scheduled webinar is Duodopa Overview Q&A. And for information on the Parkinson Association of Alberta, please visit our website, parkinsonassociation.ca, or follow us on social media. This webinar will be available as a recording on our YouTube channel.
Yeah, so I can write a couple of names just really quickly, and I'll put them in the chat box. So, and a lot of these are stores that they have multiple locations. So these are just the ones that I remember from working in the hospital and from some experience with home care. So there's one's called Med Mobility. Healthcare Solutions is another one, and I believe there's one called Congdon's Aids to Daily Living. So those are a few that I can think of, and then Eco Medical. So some of them, what I would say is that you would really sort of want to look at their website or call them and see what they have, just because some of them may have more of the bigger equipment, some of them may have some of the smaller equipment, but I'll just write down those 3 names if you want to and put them in the chat. So if you want to sort of write those down and then look up a little bit more about them. Definitely most of those have multiple locations throughout. And a lot of those have locations throughout Alberta. So I think Congdon's Aids to Daily Living is just in Edmonton, but Med Mobility Healthcare Solutions and Ecomedical, I believe, are throughout the province.
Perfect. And then I found Pearson's new name is Performance Health. And I put it in the chat box.
Great. Thank you very much. So we just had someone ask that I repeat the next webinar again. So our next webinar is going to be on January 20th, and it is on the Duodopa overview and question and answer. So thank you very much again for joining us today, and have a lovely day.
Thank you all for joining.